And welcome back to All Day Live. Coming up on 12:30, we've been hearing the terms mental illness, mental health being used a lot more lately in news stories, sound bites from different people, even in our conversations, I think, with friends and family. We wanted to just try to understand more about the terms that we're using and how we're using them. And again, I'll say the same thing I said in the prior segment about Jimmy Kimmel. This is like a no-win. These are no-win conversations, and where I think just know that the intent is to try to stay on track with things, and the intent is to stay there. And if it veers, I would apologize to anybody who's offended by anything, but the intent is to really just kind of stay and treat these stories as much as we can head on. Having said that, joining me now is Todd Archibold, CEO of Prairie, one of the nation's largest providers of psychiatric care for children, adolescents, and adults across Minnesota. Thank you so much for being with us, Todd.
Thank you, Amy. I appreciate the opportunity to talk about the subject, and I appreciate that sensitive lead up to this as well. It's a very, very important topic to create some to create clarity and raise awareness.
Yeah, thanks. We'll do our best here to play it straight. But I did want to start with, I think, the difference between mental health and mental illness. Can you help us just at that base level?
Yeah, Amy, we like to say, mental illness is real, it's common, and it's treatable. And we say it in this way because we want to raise awareness. We want to help people understand that it is common, doesn't have to be stigmatizing, and treatment works. You can get help. Nearly 1 in 4 or 5 individuals will experience diagnosable symptoms of an illness in their lifetime, and nearly 70% of those will experience those symptoms before age 14. In the long term, less than about half will actually get the services that they need to feel better. And again, treatment does work. So we use this phrase to, again, raise awareness, decrease that stigma, and hopefully help people connect with the services that they need. The most common illnesses that people will experience are types of anxiety or depression, again, highly treatable through evidence-based psychotherapies and medicine. The DSM-TR5, which is what psychiatrists use to help understand various types of conditions, identifies nearly 300 types of illnesses ranging in severity and duration, each in themselves. But to talk more about mental health, which I appreciate you kind of creating that distinction, sometimes I'd like to draw comparisons to physical health. And keep in mind, the mind, the heart, and the body are all one. We don't separate them, and what's good for physical health is good for mental health and vice versa. But just as we think about our physical health, and we take care of ourselves by eating well, having good social relationships, engaging in exercise, and getting good sleep, we also see primary care providers who offer preventative care, do diagnostics to make sure that our blood pressure is in check, our cholesterol is fine. We take care of these things on our physical health, and we talk about them as well. Even sometimes when they get gross, we talk about GI issues and rashes that we may be experiencing, but we don't do the same with mental health. And interestingly, all those things I talked about to take care of our physical health, again, also help support our mental health. Unfortunately, there's not a lab or a blood test that we can do to diagnose ADHD or anxiety. So it takes us being proactive, engaging in our social relationships, and with primary care to help make sure that we're both physically and mentally well.
Yeah, and it's anecdotally, I think, I don't know how many people feel this way, but it feels to me as though everybody's dealing with something on some level, if not today, maybe tomorrow or a year from now. So some of the statistics that you sent me, 1 in 4 people will experience diagnosable symptoms in their lifetime, and then nearly 70% of the symptoms onset before the age of 14. So we have some data points there. I'm curious, though, too, how can we keep track, really, of data when we have so many soft spots here, people who are falling through the cracks, who don't ever get a diagnosis, the struggles come and go? How sort of reliable is the data we're collecting?
Yeah, well, again, first and foremost, making sure that people have the awareness and understand mental health and mental illness and are getting connected to people when they need it, at the right time and the right level of care. I think there are basically 3 main barriers that prevent people from getting the services they need, and oftentimes, being identified and And the first exists in both, physical health and mental health, but it's, you lack access to care. You don't have transportation, internet, you don't have insurance, no way to pay for care. That's a major barrier we need to break down so we can better understand how people are feeling and how their health is across the board. The second, which is particularly devastating for mental health, is the stigma, or really the fear of discrimination, that there are so many people struggling. As I mentioned, it's quite common, but less than half will get the help they need because they're afraid that they'll be discriminated, that they'll be judged, that people will think of them differently in their social circles, at school, and even at work. And the last one, which I think is important as well, and this is a significant barrier, is oftentimes people just don't know. And again, this goes back to that phrase, mental illness is real, common, and treatable. If people can better understand it, they're more likely to get help. And, one more kind of physical health comparison, for years I've been waking up with this, achy shoulder, and I just kind of deal with it and shake it off and take ibuprofen. There's probably physical therapy. There's probably other things I need to do to deal with it, but I just kind of manage it day to day. And oftentimes people are doing the same with their mental health. I don't know what a lot of physical illnesses feel like, for example, heart disease, hypertension, but I know what anxiety feels like. We all do. I know what depression feels like. We all do. We have to talk about these things to help people get the connections and the services they need.
And I want to circle back on that point in just a second, but also I think in the context of, one of the reasons that we wanted to have this conversation is because, recently we've seen, and again, I have to just be so careful what I say, but not casting any judgment here, but we have seen connections made between mental illness and some of the shooters in recent, mass shootings or targeted shootings. Again, not saying everybody has a right to say or feel how they want, but from your perspective as a mental health professional, what concerns you the most about making that connection?
Yeah, I appreciate, again, the sensitivity around that question as well, Amy. Conflating mental illness and gun violence it's inaccurate, it's stigmatizing, and it's harmful. Most violent acts are not committed by people with a mental illness, and diagnosing a mental illness does not predict violence or gun violence. In fact, more individuals with a severe mental illness are more likely to become victims or taken advantage of. We need to be very careful not to perpetuate that stigma, make those correlations, which don't exist. And just creating more barriers for those who need care.
Wanted to also wade carefully into this next question. Debated whether or not we kind of wanted to go here, but I think I'd rather risk talking about it than maybe not. But we've also seen, in some cases, people make connections between some, and in some cases even many, of the violent shooters in these recent cases, making connection between that and the trans community. You and I can acknowledge, I guess, that these are very real concerns and conversations that are being had all over the country, and admittedly, those answers are, I think, bigger than you, they're bigger than me in this very moment. But my question to you is there anything that you can tell us based on data about things like mental health access in like the LGBTQ plus community?
Yeah, this is as stigma is a barrier for everybody, in particular in the LGBTQ community. Rates of bullying and discrimination can be 3 to 4 times that of their peers, which of course increases depression, anxiety, isolation, and interestingly, while nearly 50% of the general population will actually get connected to the services, it's more like 15% for those who are marginalized and discriminated in the LGBTQ plus community. So again, in a similar fashion, we need to make sure that we are raising awareness, creating access, destigmatizing things, not everybody to get the services, the help that they need. Yeah,
and from that, I guess, really important moving forward is we've seen, calls for more mental health resources. I think that from both sides of the aisle, if we're talking about it politically, that's a broad ask, and I'm sure there are some more specifics that people are asking for. But what do you think would be the most helpful sort of direct resources that we could implement quickly to try and prevent another senseless killing?
Sure, and again, being careful not to conflate the issues. I mean, these incidents are.
I know it's so hard. I just did it. Yeah, I just did it.
And they're incredibly complex, and I appreciate that humility as well. I mean, these incidents, they send a ripple effect across families, communities, all of us. Again, beyond increasing access to care when people need it to the right levels of care, decreasing stigma, raising awareness. There's so many people who are affected by these tragedies, rippling through our communities, that we need to create care for. And in so many ways, it starts in the front lines. And when I think of the front lines, it's primary care, which for children are pediatricians. For adults, it can be internal medicine. It can be OB/GYN. It's teachers, it's coaches. And I think there's an onus on employers to create resources, whether it's employee assistance plans, programs, or other ways just to create, groups to be able to talk about these things. It starts on the front lines. And again, understanding that mental health is health.
Todd, what are resources like right now? I remember post-COVID, right away after COVID, a lot of us experienced, anecdotally, friends, family, it was a 6-month wait to get in to see a therapist or get help, for any kind of anxiety you had or any issues. You'd have to go to the ER if you had someone in your family who, maybe there was suicidal ideation or something like that. What is it like now here in 2025 for resources?
Yeah, unfortunately for decades, it's remained about the same. It's been hard to access resources when you need them. And we have a workforce shortage of specialists. I think oftentimes people underestimate the depth and breadth of what our mental health system requires. And, it was once said by a dear friend, our mental health system is not broken because we've never built it. We don't have the people to provide the specialty services. It's an underfunded system. And unfortunately, right now, for those in crisis who need immediate intensive services, the emergency department calling 911 is often the most common access point for services. So the pressure to decompress medical providers remains. And what we've done as a community is actually built a really neat tool called the Mental Health Collaboration Hub. So for those individuals who are in hospitals, in EDs, who need more intensive mental health services, the Mental Health Collaboration Hub is a way for those providers to upload de-identified information about the case and then match them across our entire state to all the specialty providers who have the availability and the capability of caring for those unique situations. We launched the Mental Health Collaboration Hub about 3 years ago, and we have nearly 250 organizations participating to help make these connections, and we've helped over 520 youth get out of those boarding situations and into the appropriate care environment.
Okay, just really quickly, just about a minute left, but a couple of resources here. Prairie Care does Family First, and this is not a commercial for that, but it's a really important resource, and I didn't want to not do it just because I didn't want it to seem like a commercial. But Families First, if you go to your website in Prairie Care, you can get immediate access to help right away without maybe going to the ER first, which can be a traumatic experience for a lot of people. Also, can you just really quickly mention County Response Services and 988? Can you tell us just really quickly about those?
Absolutely. Every county throughout the state has crisis response services. They're managed a little bit differently, but you can access those finding the information online. A quick Google search will get you there. And then, of course, 988, you can text or call anytime and get support.
All right, Todd, thank you so much. Appreciate it. Good information. We'll keep conversations going. I may not always get it right, but we'll just keep conversations going nonetheless. Thank you for your time today. Appreciate it very much.
Thanks, Amy.
All right, take care.